Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association. Here's my roundup of the key issues in dentistry for this week. Well, it's 2 weeks now since practices in England were given the green light to return to face-to-face care, but we still don't know the final terms of the NHS contractual provisions that will apply to the former lockdown period, let alone how things will work out in the current circumstances, and that's clearly not acceptable. So just to recap, practices have continued to be paid their NHS contract values with some conditions attached. One of those being that an abatement for costs not incurred during the past few months will be applied. You'll have all been anxious to know what that reduction is, and we've been arguing the case on your behalf now for months. Whilst it's felt like we may have been here before, I am confident now that we'll see an announcement on this at the start of next week, and we'll let you know as soon as we have news, of course. We may also see that announcement cover how the contract will work during this current period. Discussions also continue for the rest of the financial year, and we're seeking to ensure that whatever is in place recognises that it's not going to be easy for dentists to get back up to full capacity anytime soon. We're also continuing to put the case for practices relying on private income, and we're involved in a piece of work with other stakeholders to look to demonstrate the potential impact of the pandemic on mixed income practices over the coming months, and we'll be looking for your help with some of that in the form of some research. Finally, we haven't forgotten about the position of associates and other staff not getting their NHS income at the moment, and we've continued to push on that issue with NHS England and with the Department of Health, and more on that as well next week. We made headway in Northern Ireland this week when our team met with Health Minister Robin Swan on Wednesday. Once again, pressed our concerns on issues for dental practices across the country, and the Minister recognised the enormous contribution the dental profession has made in the battle against COVID-19, and he committed to ensuring that dentistry will be an integral part of the real rebuilding of health services. Most significantly, he signed off on 3 million pieces of PPE to be made available to general practices across Northern Ireland, and deliveries of that PPE are due to start from next week. We are also continuing to press for input in discussions around the shape of funding arrangements that will come into effect after August, and we'll keep you posted on that. Our Northern Ireland Director, Tristan Kelso, has written a blog this week that tells the positive story of dentistry really having its voice heard across the region. We've had unprecedented levels of engagement with political representatives during the crisis, and we remain hopeful that it will lead to a positive outcome. So do have a read of Tristan's blog, which is linked below. Yesterday, we presented evidence to the Welsh Parliament Health Committee on the position of dentistry in Wales during the pandemic and the implications for patients. We put it to the committee that whilst high street dentistry wants to care for patients, many practices may struggle to survive the combination of higher costs and lower patient numbers. We made a strong case for private dentistry, which has been left to fend for itself and is now having to face up to job losses, especially as the furlough scheme unwinds. Meanwhile, despite continued NHS funding and the very welcome suspension of activity targets, mixed contract and NHS providers are still operating at a loss. This is clearly not a sustainable financial situation, and dentistry in Wales requires urgent support if it's to remain viable. On the back of the evidence, Welsh General Practice Chair Tom Bysouth has written a blog, which you'll find below, on the 10 things that must change in dentistry across Wales. Have a read of that, because we'll be picking up on all of those issues with Health Minister Vaughan Gething in the coming weeks. Also this week, there's been a lot of anxiety over the Welsh Government's suggested variation to NHS contracts. and what that actually means for individuals in practice. So our representatives met with CDO Colette Bridgman to clarify these issues, and we've addressed those in a blog as well as in our FAQs. We explain what the UDAS is and provide details on the patient assessment ACORN system, and you'll find those links below this film. In Scotland, the date for phase 3, when dentists can offer routine care without aerosol generating procedures, is fast approaching. It starts on the 13th of July. So we've been in ongoing talks with Scottish Government regarding the return to NHS dentistry and are pushing for additional funding to meet the increased costs of reopening practices. We've also written to the Public Health Minister this week, seeking assurances that the public dental service budget will be maintained in 2021. The PDS has done an outstanding job in setting up the urgent dental centres, and it's vital that this budget is maintained so that they have the capacity to treat their patients. If you received the newsletter yesterday, then you will have seen a blog by BDA Scotland Director Phil Grigger, which detailed the way in which we are campaigning for dentists across Scotland right now. So if you haven't seen it, have a read. The link is below this video. We have a new risk assessment course available online, which is designed to give you the tools you need to decide appropriate safety measures for your own practice. It counts as 1 hour of CPD, and hundreds of members have already made use of it and given us great feedback, so do take a look at that. Also, if you missed the case for dentistry on BBC Newsnight last night, you can watch that on the BBC iPlayer, and we'll link to that below. They covered the issue of fallow time and the reduced capacity for practices. Our Vice Chair, Eddie Crouch, spoke about the limitations placed on dental practices and what this means for the service. Talking of fallow period, we're expecting that a cross-nation working group doing research on this in a dental setting will complete its work and report next week. And we know how very important that is, and we'll share that with you when we can. We'll continue to communicate all these issues and ensure that your voice is heard across the media and to government, and do our best to bring about the changes and improvements that we know dentists across the UK need so much right now. So that's all from me this week. Have a safe and healthy weekend, and I'll speak to you again next week.